120 health workers have died in West Africa since the Ebola outbreak began early this year. In the United States, public health experts are working to reassure the public and medical workers that the virus does not endanger communities here. VOA's Pearson reports.
The first Ebola patient to arrive in the United States flew on a plane specially equipped and designed to prevent the spread of the virus. That patient, Dr. Kent Brantley, entered Emory University Hospital through a special passage to the isolation unit. During a news conference outside the hospital, Dr. Jay Varkey reassured the public that they were not at risk.
I can't think of a better place in the world other than Emory University Hospital to care for this patient.
Some hospitals in developed countries have isolation units equipped with their own laboratories. Technicians do all the lab work right in the unit. And yet not every worker at Emory was comfortable with having an Ebola patient there.
Because a lot of the feedback we got from our staff was this perception was that this infection is a death sentence, that this infection can have 90, nearly 100% mortality rates.
Varkey and the hospital's other infectious disease experts met with staff members.
We had key leaders, so in both nursing and as well as the medical staff, infectious diseases who actually rounded in the hospital itself, from nursing station to nursing station, from unit to unit, to make ourselves available to answer questions.
Brantley eventually recovered, as did a second patient, Nancy Wrightball. Dr. Rick Sacra, the third Ebola patient flown to the U.S., was successfully treated at the University of Nebraska Hospital.
Though my crisis has reached a successful end here, unfortunately, the Ebola crisis continues to spin out of control.
Modern hospitals in developed countries are far different from the situation in Africa, where more than 240 medical workers have contracted Ebola in recent months. Most hospitals lack the supplies to contain the disease. In this Ebola holding facility in Sierra Leone, at least 3 employees have died of the virus. Nurses recently protested in Las Vegas, saying they are not trained to treat Ebola patients. Surveys show many Americans are afraid the Ebola virus might spread inside the U.S. Dr. Thomas Frieden, the director of the U.S. Centers for Disease Control and Prevention, tried to tamp down concerns after a Texas hospital admitted an Ebola patient who had arrived last month from Liberia.
It's only spread by direct contact with someone who's sick with the virus, and it's only spread through body fluids.
Frieden says the Ebola virus is something to fear, but as more people get into treatment early, more people will survive. Pearson, VOA News.